This technique is called dynamic angiothermography, DATG. It's a new functional diagnostic tool based on the imaging of mammary gland normal vascularization and detection of the angiogenetic microcirculation and the neoangiogenetic vessel. Its morphological is a qualitative image of breast functional blood supply. It's non-invasive, reproducible, with in study with the medical physics of the University of Bologna on 7,300 patients with 25 years of follow-up, with an excellent integration with the other breast diagnostic technique. Is just put into the International Classification of Disease, the revision of 2002, with the number 88.85. So you can use this technique without problem in all the hospitals of the worldwide, and is reimbursed from the assurance and National Security Social. The World Health Organization and the Foundation, Geneva Foundation for Medical Education Research, improved me to develop this technique all over the world. We have all the certificate that we need, the certificate of diagnostic thermographic device, or the fabric with the system of quality, and we have also all the certificate from Russian Federation, Kazakhstan, Brazil. And the three fundamental characteristics of the DATG are: each woman has an strictly personal flow line pattern like a fingerprint. This pattern remains constant over decades in absence of pathophysiological changes, and the pathological modifications are independent of tumor size and shape. This is a normal flow line that points in termination toward the nipple, and when there is a abnormal neoangiogenesis, not normal vascularization, the images are in this fine, not point in termination, like this all suspicion flow line, or a captation of two vessels. The cancer is more easy because we have three vessel, or a malignant star, or all the flow line that converge toward different territory. The scientific basis of this technique are the visualization of the progression of angiogenesis. Here you can see very well in brown the vessel, and in normal, the first slide on the left, when you see the hyperplasia or in situ cancer, invasive cancer, you see very well the change. The advantage of this technique are detection of breast cancer, useful for a young patient, and screening for lobular carcinoma too, for pre-invasive lesion, early epithelial lesion, and to check the therapy, antiblastic, hormonal, repressant therapy, and you can use this technique for both the radiologist, the gynecologist, the surgeon, oncologist, and generalist too. Here you can see very well breast cancer in mammography, and the three vessel with hotspot in thermography, but 3 mm of lobular carcinoma in situ of a microcalcification you see very well too in normal surgery. Here a cases of cancer on right breast, and the normal is left is normal. You see very well the comparison between the mammography. Sometimes a mammography is difficult to give an interpretation for BRAF3, for example, or for microcalcification. So this technique can be useful. For example, here is a microcalcification here, and after the surgery, you see that there's no residual tumor. Was a ductal infiltrating carcinoma of 8 millimeter. With MRI is useful too, because you can see very well the different, like in MRI, because it's a functional technique, and it can be used integrated with the mammography. For example, here we have a star, mammographic star of a cancer, but we have no vascular signal, and the histology was fibrosis. The screening is one of the most important application. Here you can see 16 here of constant of the image of another patient, 20 years, another patient, 25 years of constant of image. And when change there is a problem. For example, here in 50 months we have the arrow, white arrow that remain the same, the yellow arrow disappeared, and the red arrow see 1 millimeter of carcinoma. Here you can see an appearance of 8 months, after 8 months of a new vessel, and was a carcinoma. From 79 to 85, the images stay the constant and change in the last year. It was a mixed lobar and ductal carcinoma inside. Here is the machine with 3 plates and higher cooling. The visit is in this way, and this software easy to use and compare the image to have the inter-story of the patient. We have published in different field, anatomopathological, anatomy, physica medica, oncology, gynecology. And in conclusion, the practical considerations are is rapid, economical, non-invasive, can be used at any age, very good compliance. The lobular one you can see very well, no radiation, chemical, ecological, reproducible, rapid. We have the response immediate, and you can use enlarged diffusion of this technique of all the specialists. At least I thank you, and I introduce you my late father, Professor Giancarlo Montruccoli, that was the inventor of this technique. Thank you.